I've spoken to Jennifer McCreath, who's well known in the community, and kind of wears her life on her sleeve, as do you now.
Yeah.
But are there others in the community that you can turn to for comfort or support or
There's
solace?
a lot of people in the community.
Really?
It would actually surprise many people, but they are here and they are easily found should somebody decide that they want help for themselves.
So, Christopher, what's your message to government now? And I'm sure they listen, but what's your message to government about the rights that should be afforded to people who are to transgender people like yourself?
Realistically, the rights are there. They claim that they will cover it as long as you go back and forth to Toronto, but I want them to review the policy and say the Toronto Clark Institute is not necessary when there's doctors here. If they can remove that.
Just another day. My name gets mentioned on the radio. How about that? Today is Thursday, November 7th, 2013. I am Jennifer McCreath, and that was John Furlong, CBC Radio Noon, having a chat with Christopher Higdon, a transgender person in Newfoundland. Yes, as Chris said, there are many of us. Anytime you've heard me say that I'm the only one, I'm lying. If I have ever said that, it's just to try to bring more people out. There are dozens that I know, and there are probably dozens more that I do not know. Just because we are not all on television and don't have YouTube sites doesn't mean we're not here. We are here. And it's great to see others like Christopher Higdon stepping up to the plate, talking about trans issues in the media, talking about healthcare and the fact that our provincial government healthcare policies and procedures are out of date and inadequate. As Christopher, as you heard him say, and I echo those sentiments, there's absolutely no reason to be sending trans people to the Clark Institute for assessment. Any medically credentialed doctor can work with trans people. All you need is a general practitioner, a psychiatrist, and a clinical psychologist, and away you go. I've never stepped foot in the Clark Institute, never planned to. It's cost me money because it's meant I've had to pay for healthcare out of my own pocket. But the time is now to eliminate that clause in our provincial government healthcare MCP, medical care plan policy, that says one must go to the Clark Institute in order to be approved for funding. Newfoundland doctors are good doctors. If they say trans people need medical treatment, then that treatment should be provided. It should be covered. That interview was recorded, I believe, earlier today before the news broke that our provincial government Minister of Justice, Darren King, made an announcement in the House today that he plans to table a motion to add gender identity and gender expression to the Human Rights Act of Newfoundland and Labrador. Congratulations, Darren. It's about time. We've been calling for this for a long time. Newfoundland's finally taken another step forward to get up with the times, and I appreciate that. At the same time, there's still lots more work to do. The healthcare is just one major issue that remains to be looked at. Access to employment for trans people in Newfoundland is still a significant challenge. We are being denied employment. We are winning job interviews and still not being hired. Access to housing. Many landlords are refusing to rent to us for absolutely no good reason. Education system. We need to be covered in the curriculum. EGL Canada. They'll talk your ear off about this all day long. Education about the trans community needs to be part of our curriculum. Our professionals need to be better educated as well. Violence is still very much an issue and fear. Trans people are often faced with threats of violence and threats of other sorts of issues. I'm going to keep this brief. It's not going to be a long video, but Chris Higdon has a website, indiegogo.com. That's INDIEGOGO.com /projects /Chris-campaign. The medical care plan will cover certain types of surgeries for trans people or any people who attend Clark Institute. It's my understanding, though, that they will not cover top surgery for trans men or trans women. This is a surgery that Chris needs, and Chris is looking to raise funds privately to have this procedure performed. I generally frown upon individuals fundraising for their own purpose because I'd rather see people take steps to solve the full problem, but Chris is openly looking to petition government and raise this issue with to get the healthcare policies changed. So this is not just about Chris. This is about helping everyone. So I'm glad to give that shout out. Go to Chris's website and take a look take a look at that petition. I think it's a great idea. Thank you and congratulations to you, Chris Higdon, for stepping up to the plate. And thank you, John Furlong, for interviewing Chris. It's great to see more trans people and trans issues getting coverage in our media here. And still a long way to go, but a couple of big steps taken today for sure. Thanks everyone for watching. I'm Jennifer McCreath.